Now a totally different world will be open to you. This is forensic imaging. In forensic imaging we have, if we go to the beginning, right to the beginning, then you see here two important points that we should then also consider. This is mimics of rib fractures and the head brim rule. And the learning objectives are mainly what should we be aware, in which situations should we consider that some issues may be brought to a court. There is now in Europe a relatively long list existing when referrals to radiology should be done with view on forensic aspects and also other so-called non-medical imaging referrals. They all base on the Radiation Protection Basic Safety Standard Initiative. That's the abbreviation from 2013. That's now a rule that is mandatory for all European countries, members of the European Union. And you see these non-medical imaging exposures are justified in case of health assessment for employment purposes, health assessment for immigration purposes, health assessment for insurance purposes, radiological age assessment, ionizing radiation for identification of concealed objects within the human body, use in medical radiological equipment, for the use of concealed objects or attached in the human body, concealed humans as part of cargo screening. So it is also allowed to make fluoroscopy of cars to find out if people are inside or not. So this is a relatively long list of indications to imaging that are official law, and we are probably not that much aware in what is the topic of our work. This is to one degree external causes of violence, court expert opinion, post-mortem analysis. I will more or less skip that because that's really something that is in the hand of specialists. And after all, what is the sense of what we are doing? Excuse me, I'll go back here. So this is a typical example of how we are confronted with. This was a patient. Here I took it out from the literature. Here he has a typical fracture. It's referred to as the boxer's fracture. In fact, those fractures are not common in boxers because people who do boxing, they know how to hit. Yeah? These are usually injuries done by people who are not experienced in how to hit their fist on somebody else. And then you have this trauma. Yeah. However, what I show you here is a patient that I had referred from a forensic medicine specialist, and he was a victim, but he had more or less the same fracture. His hand was hit by with a chair, yeah? And he also had earlier post-traumatic abnormalities. Here he has also another fracture on the base of the fifth metacarpal. So we have to be a little bit. We have to take care not to write in our reports a direct causative chain between what we see and what might have happened, because that's the offender's hand and that's the victim's hand. This is another case, and I would ask you to show us the video. This was a patient who he was I will show you here, yeah. This is the history. A male immigrant, he was a basketball player. He has been hit during play, and this case was brought to court because the question was it an indirect force so that the patient twisted during the basketball game and hit his knee, or, as the patient said, was he attacked from the opposing team? Because he was a very tall immigrant, 190 centimeters tall, or almost 2 meters, and he was very important for the team to win. because of he was so tall. And therefore he said somebody from the opposing team hit him to knock him out, and it actually happened like that, because when he was injured, his team lost all the games afterwards. So the question was to the radiologist, was this something from somebody from the opposing team, or was it that he twisted his foot? What do you think? You think it was the offending person from the team? It was an attack. Yeah, that was the same. What we also commented on. This is a pure valgus injury. A twisting injury rarely is a pure valgus injury, and therefore the medical court's expert statement was attack from the opposing team because no rotational component of injury. Are you happy? Yes, please.
I'm wondering if, on the other hand, if it was some twisting, would you probably see some bone marrow edema also because of
Yes. Yes. Yes.
So this was
Exactly. Twisting injuries would have a rotational component, would have probably cruciate ligament abnormality, would have bone marrow edema, would have meniscal injury, would have complex corner injuries and that. But what you see here is a really pure valgus, and that nicely explains that somebody hit his knee from outside so that he had this valgus injury. This is another example, and I hope that you are not bored now by discussing topics like this. Nose fracture. That's the really daily work that our coroners and forensic medicine specialists have. Because the radiology reports here, at least in this country, are not sufficient for the coroner's work. What they want to know is it a superacute or an old or a fresh fracture? And is it one fracture line or are there more fracture lines? Because if a patient has a fracture of the nose, I don't know how many of you had fractures of their noses. Probably due to your lifestyle, it only rarely happens if it in any case happens. So people who have a tendency to have nose fractures usually might have had in their past also a nose fracture. And to report that there is a nose fracture is not enough for the forensic purpose. We need to tell, is it fresh or is it old? Or is it both? May also be both. Yeah? And the next topic is that if we have a transverse line, then it's definitely a fracture. If we have longitudinal lines, then it could be also due to a suture or a sulcus of an artery. Yeah? So this is something that we have to keep in mind. And then we may have complex situations with fresh and old fractures. Yeah? So this is something we need to mention. The next, this here is again mentioned also in this publication. And usually CT is the best modality to diagnose fractures of the nose. However, in clinical practice, at least here in this country, radiography is the most commonly used method to diagnose this. Ultrasound has also a very good potential for diagnosis. But what we shouldn't forget, and this is something that is in the same way what Klaus Hergan just has mentioned, in many cases of cranial CT, of the brain, you see on one of the last slices a fracture of the nose, and usually it's not reported because we radiologists are all focusing on the brain and on the intracranial hemorrhage, but not that much on the fracture, and we should keep an eye on that. Another topic that is also very, very common in the same way as in the nose fractures, if I meet the coroners and the forensic medicine specialists, that is rib fractures. This here, for instance, was a case of a 76-year-old male. Rib fractures were overlooked in the trauma bay, and You see, they are very slight fractures, only some slight malalignment, so it was really difficult to diagnose them. But that's something then, if it is brought to court, then they need to know, was there a fracture, was it not, because it's totally different handled if there is one or if there isn't. Also, in this case, ultrasound is very helpful. CT, also low-dose CT, has been reported in the literature too, is very helpful. But in the majority of practical situations we have in our trauma hospitals, radiographs are used. And what I routinely do is that I talk to the patients whenever possible, and that I ask our technicians to put a marker like this type here, because it nicely indicates where the fracture might be. And it is also very helpful if the images are brought to court, because then the judges, they see, oh, this was a radiologist who really did work exactly. Yeah, and this is also very important for them to have the impression they are no medical specialists, they are no physicians, so they are relying on some indirect findings of how to get along with these situations. Very helpful is also this unfolding technique. If available, we are using it in our hospital routinely. It's an add-on in every case of CT done in the trauma bay, and it is helpful, and it has been proven by Helmut Ringel from Vienna in Austria that there is definite effect on sensitivity and specificity, and it accelerates the reading time of these patients and their films. Next topic, intimate partner violence. Intimate partner violence is a very, very big topic, and here you have an image of a patient reported that she had fallen over her dog's leash 4 days before. Totally wrong history, because it was violence done by her partner. But usually patients don't tell this, and therefore it is our task to find out what are the abnormalities indicative of intimate partner violence. There is a list of such findings, and unfortunately they are very unspecific. You see, imaging findings inconsistent with history provided. Okay, could be here, but couldn't be. Yeah. Compare with previous exams, repetitive visits of such victims may be more often. That's very important. But it only works in those who are together with very aggressive partners, so that they seek help in the hospital more often than other people. In many cases, it's not that the case, but we have to check for previous images, and that's very important. The location of injuries is typically located in defensive places, like arms, where the victim tries to protect. The mid-face is very, very commonly encountered, like nose fractures, and multiple site fractures are also, if they occur, may be helpful. But that's also not very specific. Yeah? We have lots of patients, especially osteoporotic patients, if they have, after a fall, may have multiple fractures too. Chronic fractures may be characteristic. Victims may visit the hospital sometime later to the event. So these are the general rules that I took out from this publication. And this is something that you don't find in literature that much, but for me it's very, very important. We shouldn't forget that about 10% of the victims are males. And this is something they are almost never diagnosed in the hospitals. Actually, nobody knows how many percent of the victims are males, but there is today a general agreement that 90% of the victims are females, 10% are males. The males even are more difficult to be diagnosed because they are very ashamed, they never tell the truth, and the awareness among the doctors is very, very low. The reason why males are attacked by females, by their wives, or other form of partnership, is usually there's always some psychiatric problem behind it. Usually a female doesn't attack her partner, but if she is under alcohol, or if she is a drug addicted person, or if she has some other psychiatric disorder, then this may happen. And then we fully understand that it could happen. And this is here something that, a text that I found in the Salzburger Nachrichten, which is a local newspaper that we have here, and this was 1 year ago, and you see what here was described with a noodle walker. She was hit in Vienna. According to the police, the incident was triggered by a dispute over cigarettes. This was a very easy diagnosis because the police already had taken the patient. The patient was brought to the hospital by the police and the local ambulance. This was a female immigrant from Africa, and she was found in the stairwell, dressed only in a bathrobe, and according to her own statement, she had been beaten and choked by a person known to her, and the patient stated that the person wanted to kill her. And that's something, if you have the story, then you know it. Yeah, you understand here the fractures, typical fractures due to hyperflexion trauma of the cervical spine. That was the abnormality found here. Choking in some degrees can be very important in post-mortem imaging, because in choking you have a distinct finding, and that is that in the larynx, the arytenoid cartilage may luxate. And this is very difficult to be proven by the corona during this dissection, because during dissection the corona opens the larynx, bloops, the arytenoid cartilage falls down. So he cannot prove that it was luxated. Therefore, for us with CT, post-mortem CT, this is very easy, because we can see the subluxation or the definite luxation of the arytenoid cartilage, and therefore can give the proof that there was violence. Suspected physical abuse, also referred to as SBA or non-accidental injury, formerly called the shaken baby syndrome. A typical example, and that was here, a child with posterior rib fractures. Posterior rib fractures are very typical. And the second typical finding is not the same age of the fracture of the right and of the left side. Here, this is fresh, only a tiny fracture line, and here you see callus formation. So that's almost a definite sign. This is another case of a 3-month-old boy brought by his parents who could not say that he had been injured. But what you see here is a fracture here on the upper arm. Here you have callus, so different ages of the fractures. So these are the typical findings that you see in such cases. And this is a wonderful drawing that I took out from the radiology assistant homepage. And it nicely shows the problem in this case of what formerly was called shaken baby syndromes. So typically the metaphyseal fractures that you see here, avulsion fractures of the metaphysis. Rib fractures, especially the posterior part, but could also be the lateral part, due to the compression of the offender's hands. Non-parietal skull fractures, yeah? Sternal fractures, outer third clavicular fractures, scapular fractures, and spinous process fractures. These are the typical findings that you see here. And if you now go on with this story of a 5-month-old boy is brought to the trauma unit of a local hospital by his father, and the father tells that they both fell off a bicycle, then it is easy for you now to understand that, of course, all those fractures may be associated with a better child or non-accidental injury, but the very typical example is metaphyseal corner fractures. In case of metaphyseal corner fractures, there's something that you really must know. It is not 100% specific for non-accidental injury and child abuse. Metaphyseal corner fractures or mimickers of it may also be observed in normal calcification, buccal fragment, rickets, and secondary hyperparathyroidism. And Professor Alan Oestrich from Cincinnati published about that topic, and he personally told me when I met him some years ago that he was involved in a case in Scandinavia where a father was imprisoned erroneously for 10 years because metaphyseal corner fractures were diagnosed in his child who actually suffered from rickets. So 10 years in prison because of a wrong radiological diagnosis. And this is something that we have to keep in mind. And so it's always necessary in such cases to consult a specialist radiologist who is able to give more information. Sometimes, this is very rare, I didn't find it in literature, you may see these bicatenal fractures also in the proximal part of the femur. I had this case and looked up in literature. Interestingly, didn't find any description. And here you also have fracture here and fracture of different age here. So, next story. A 4-month-old boy is brought to his parents' the pediatric clinic because of fell off the diaper changing table. That's a typical story that the patients tell you, the parents tell you. So it quite often happens, in fact. Everybody here who has children knows that falling from the diameter table is something may happen. Yeah. And now the question is, what is the first imaging of the head? There is a discussion in the literature, but usually it is accepted today that despite the radiation exposure, CT of the head is the modality of choice that should be done. But also a considerable number of people recommend MRI. However, MRI to be done in such small children, this is very, very difficult to be done. There is a wide field, a really wide field of neuroradiological imaging in case of non-accidental injury. And here you see such a case with the typical fractures here, abnormalities in the brain tissue. You see the blood accumulation with hemosensitive sequences. You may even see blood accumulation in the form of dark spots. Throughout the meningeal spaces and the brain tissue. It is one of those busy slides that I have here. You see also again a typical story, yeah, how parents come and try to explain what happened. And unfortunately, forensic imaging is such a wide field of knowledge that we have to accumulate that I only can mention it on one slide. This is another case, also a very typical situation. Now we move on to the second part of this presentation, and this is after the normal causes, the external causes of violence that we have to be aware of. The second topic of indications is that the court needs expert opinion. And this here is a case of a 23-year-old male bouncer of a Viennese posh disco. And he was brought to the emergency surgery ambulance, lying down around midnight after a stab wound to the abdomen about an hour ago. The crowd of people in front of the entrance to the completely overcrowded disco was waiting, and all of a sudden he felt a funny jostle. Only a few minutes later did a second bouncer notice blood on his shirt. This is a very typical situation. Stabbing doesn't cause pain. People who have been stabbed, they have a feeling of, yeah, he called it a funny jostle, of some compression, of some, but interestingly, it doesn't hurt. I never saw a patient who has said it was painful, but I guess sometimes it may also be painful. And what you see here is also a very important point. We did CT in this case, and here you see a herniation of the peritoneal fat, yeah, indicating the stab wound. Here you see that it's a sort of this direction of a bending, because due to the knife there is a telescope-like smash of the abdominal wall. And what happened here, and this was very important, was despite you didn't see any air bubbles in the peritoneum, there was a destruction of the bowel too. And this is something, here you see the opened abdomen, and here you see the lesion of the interior part of the abdominal wall. And this is something that is also very important. In many publications it is recommended that in case of stabbing we should do ultrasound to document if the peritoneum is hit or not. This is totally wrong, because ultrasound is not sensitive enough. Yeah, we need CT to be done, as I can showed you here. And what then happened is also to show you the different perspective what happened at court. Half a year later, the trial takes place. The accused person is a 22-year-old, very elegantly dressed man. His lawyer denied the crime. After 2 witnesses had seen the accused shooting at the bouncer and stabbed him, he now says that this was unfortunate and completely unintentional accident with a small defective pocket knife in his dense crowd. So this person tries to explain how he couldn't have been the offender. And that's something, in this case, the CT images were of highest importance to document that it couldn't have been wrong because of the direction of the wound and the depth of the penetration. This is again another case that we had with a stab wound through the sternum, and the direction of it is from down to up. And this was also such a case. The accused person tried to explain that he didn't want to hit the victim. But with this image that was shown by the forensic medicine specialist to the judge, it was clearly documented that the direction of the knife was from down, up, and through the sternum. So this means violence, clear documentation of violence, and therefore he was sentenced, the person. So CT images, radiological images, are sort of rather a document than a diagnosis. And this again is what we need to do. And that's what I already mentioned, the length of the stab channel for estimating the degree of aggressiveness. This is something what was totally new for me, that a length of a wound is an indicator and correlates with the amount of aggressiveness of the offender. Here, this was a 27-year-old patient hit with a hockey stick. And in this case, it was important because here, when magnifying the bone windows, you see a tiny fracture. And in this case, when it came to court, it was important to provide the people at court with the 3D images. Because here, this is a 3D reconstruction showing the Gallia hematoma. And here, with 3D imaging, you see the defect by the hockey club. Yeah? And so this is also important because, again, as stated before, X-rays or radiographs and our images are not primarily for diagnosis, they are for explaining and for documenting the type of violence. This was another case of a 33-year-old male immigrant. He was injured by policemen, and therefore there was a lot of discussion in the Austrian press when that happened on the way to the airport for being sent back to Africa. And of course, there was a clear sign of a fracture line. It was unfortunately overlooked when CT was done, and 3D imaging here nicely shows the transorbital fracture line going down here. And again, it was very important to prove that at court. Another topic is where the judges need our help is drug smuggling, especially cocaine. Our Klaus Hergan, who just gave you a presentation about the heart, published many years ago, this very nice paper about the different appearances of cocaine, heroin, ecstasy, hashish, Thai pills. I didn't know that they can have that. With various appearances here. I don't know where he did have all those preparations from to put them into the CT. We should have asked him, but he left now. And excuse me if I go back here. And sometimes, and this is very important, these packages may rupture. And what then might happen is the body packer syndrome. And so imaging has not only to be done for forensic purposes, but also in the patient's interest. Yeah? And the original publication who defined the body packer syndrome was this one in 4 patients. This syndrome was diagnosed, is in people concealing drugs in special containers within the body. And in the clinical presentation, it can be very deceptive. One of the 4 patients died, the others recovered. And this is a recent publication from June this year in the Journal of Forensic Imaging. And here you see the pre-mortem CT that was done in this patient. Unfortunately, the patient died, and afterwards you saw the post-mortem image. And the interesting case was that it was not visible that one of these pieces ruptured. In the post-mortem image, you could assume that one of those had been ruptured, but the diagnosis in this case was not possible to be made by radiology. Important is also documentation of foreign bodies. This was a 22-year-old male with a piece of glass. Glasses often contain lead, and therefore they are very hyperdense on CT images. And here the glass has totally destroyed the patient's nose and is now in front of his maxillary sinuses. Yeah. Important is gunshots. In post-mortem CT and also in pre-mortem CT, it is very easy to find the gunshot remnants because they are hyperdense, and so it's easy to see them. For a coroner performing a dissection, this may be very, very difficult. He needs hours to go through the whole corpse to search for the gunshots. And so today, usually prior to the dissection, whole body CT is done because the coroner is able at a glance to see where the metallic structures can be found. Age and sex estimation is a big discussion in science today. There is a strong tendency to do MRI instead of CT or instead of radiographs. Others are preferring radiographs. This is something I only tell you the options, and here you have such an image of one of those publications from Ata de Hoche from our department. She did this study, and usually now the coroners focus on the imaging of the clavicle. However, what my observation is, it's my personal observation, is that usually these patients all have fused fuses. They usually are all about 20 years or older, and it's only rarely that we really need all these estimations. That has totally changed in the past years. Another topic, torture. Radiologic documentation of torture. There is a very interesting book. Unfortunately, you can't buy it anymore, but done by Professor Vogel from Hamburg, and he has collected all those abnormalities. And here you see some image, male from Zimbabwe, a spear with barbs was drilled into his hands. Yeah. And this, I think, is a very, very important documentation that we have here. This is another image, Central African male. He was tortured by his tormentors, ramming needles into his back. But unfortunately, usually the people who are doing the tortures, who are performing it from the secret services, they have learned a lot. They have learned how to be aggressive without losing any traces in the victim's body. Yeah? Here, 14-year-old Iranian girl who walked through the city with a fancy makeup. For that, her toes were screwed and she lost 2 of them. So if this is the case that you have a toe lost, then you can document, but that's something you also is visible clinically. Especially in Iran, the former secret service from the Shah, the Savak, they were very, very good in extracting nails from the victim's hands and feet, and nails would grow again, and therefore there was no chance to document it. And they are also very good in psychiatric torture forms, because we as radiologists have no chance to document. Autopsy, guided autopsy, as already mentioned, there is a huge amount of work to be done, and every month in these journals I mentioned before, a lot of publications appearing, and I just skip this. You see here the number of publications is steadily increasing if you search in PubMed, and this has now is replacing the traditional forensic medicine techniques. Yeah. Fat embolism is a very important point. Yeah. There is a broad spectrum of appearances with CT, and probably post-mortem CT and probably post-mortem MRI has a potential to be even better than CT, but that's also something under discussion. From forensic medicine, there's only a small step to go to anthropology. And I guess that some of us, especially if they are working in some centers, in some medical academic centers, they have been invited to do some CT for anthropologic purposes. And my experience concerning that is whenever we had such a question and did CT of bones digged out somewhere in the ground, then the probability that a person was murdered and not died from natural causes in the prehistoric times is almost 100%. You always, at least we always could find indicators of a murder. So, take-home messages. With forensic imaging, the radiologist's understanding of violence and error is enhanced. It's a really fascinating world to see all our problems we have in our daily clinical practice, but from the viewpoint, seeing that afterwards, from this perspective. And I personally can tell you that I really had the chance to learn an enormous amount in these discussions with the forensic medicine specialists. Yeah. They are our indirect referrers, and we should be aware that in many cases, especially if we are reporting patients after trauma, we should be aware that it's not only the referring physicians, a physician who wants an answer, to have an answer from us, there's also somebody behind it, the coroner or the judge. They also want to have an answer from our reports. Yeah. Non-accidental injury is, at least in Austria, becoming less common. That's also something that we observed. Now, in 80% of our suspected cases of violence to children, 80% are negative. But that changed during the last 10 years. It wasn't the case before. There was a higher percentage of positive findings in such cases. And what we also shouldn't forget is a safety culture in radiology. We have to keep in mind that we should prevent our work from errors. And for me, is a very important point to differentiate between a mistake and an error. A mistake is something that happens if we don't consider to reflect what has happened and if a safety culture is not implemented. An error is totally different because it's a part of an implemented safety culture. And I think that this title of this publication, An Exciting Developed Field That Needs More Trained Radiologists, is exactly what I think is necessary in our profession. Thank you very much.